Welcome to the community meeting for Oneida Comprehensive Health Division. This is our fourth quarter community meeting. Our topic will be breast cancer awareness. Sugli Swakwake, Galundeze, Ninyungats. My name is Sid White. I work here as the Assistant Division Director. I've been in this role for 2 years. It's been a pleasure. Appreciate the opportunity. Before we go, I'd want to say thank you to some of the staff that helped put this together. We have Will Bartel, Nate Wisniewski, Eric Lane, and then Peggy, who helped with our survey. Do want to acknowledge the passing of Ernie Stevens Jr., a monumental leader in Indian country, so if we could just have a short moment of silence, please. Thank you. For our division, we have the vision, which is a progressive, sustainable health system that promotes Jeet Nyunkwatli Hoda, which is our ways. Our mission is that we provide the highest quality holistic health care to ensure wellness for our Oneida community, and our values are responsive leadership, communication, trust as a foundation, safety, culturally sensitive, and respect. We do try to align with the 5 principles of nation building, which is transformational leadership, strong governing systems, cultural relevancy, strategic outlook, and sovereignty. Some of the nation building themes that the Oneida Comprehensive Health Division is embracing is using relevant data for decision making, integrate Oneida values into healthcare, strengthen healthcare collaboration, create a sustainable health system, and advance community engagement. We do have some new additions that I would like to introduce. Gabby James, if you can kind of come up. She's our physician assistant, a recent hire, started with the University of Wisconsin-Madison, rotated through, and started Monday. So if you can come up and say a few words, I appreciate it.
Hello, I'm Gabby. Like Sid said, I'm the new physician assistant that's starting down in the medical clinic. I'm originally from Colorado. I moved to Wisconsin 2 years ago to start school at the UW-Madison program. Graduated in May. I was really lucky and able to do a 2-month rotation actually here at the clinic with Stephanie when I was still a student. And I just really loved the community here. Everybody at the clinic was super helpful, and really working with the surrounding community and patient population was really rewarding. So I'm very excited to be coming back here and working as a provider and seeing some old faces and then meeting a bunch of new people here as well. So just wanted to say I'm really thankful to be here, and it's great to meet you guys.
All right, thank you. Gabby's one of the partnerships with our University of Wisconsin-Madison. That's something we've been revamping with our clinical education placement, developing policies and providing opportunities. And this is one of the things that we want to do is recruiting providers to come into our system. We have Saskia Hall, a community health nurse, Sherry Graham, a dental hygienist, Andrea Hanneman, psychotherapist. So she's here if she can come up and say a few words and introduce yourself. Thank you.
Hi, I'm Andrea Hanneman. I am one of the new psychotherapists here. I graduated in May from Marquette University. I had a very strong interest in serving the community. I emphasized a lot of work within internship when I was at Outagamie County to serve the community in different areas that there were a higher level of need. So being here, I feel very honored and I am thankful.
Thank you. Andrea is from our neighbors, Menominee Nation descent, so we're glad to have her on staff. We are Marquette. I'm also a Marquette grad. Lenora Danforth, dietary. Lakin Hargrove, dietary. Paige Ninham is a recent hire for patient accounts. Kiana Paminette, patient accounts. Former Green Bay Southwest high school basketball player. Betsy Hoyda, clinical pharmacist, Nicole Culp, pharmacy tech, and then Brenna Slater, dental hygienist. So welcome to the team. Something we want to always bring providers in to provide the best care that we can. So we're excited on those. With that, I'm going to hand it off to radiology for Courtney, Georgia, for our presentation on breast cancer awareness. Yonko.
Okay, hi everyone. So my name is Courtney and I'm the radiology supervisor here at the health center. To start, I'd like to share our mission statement. Our drive is to provide compassionate, caring, and high quality X-ray and mammography services to enhance the quality of health and wellness provided to the patients of the Oneida Community Health Center. A little bit more about myself. I have a bachelor's in science from UWGB. I also then have an associate's degree from NWTC in the radiology studies. So a question a little bit more about myself as well is, why did I choose radiology? My passion started a long time ago when I helped care for my grandfather. He had diabetes, he had blood disease, a bunch of other issues, and I just wanted him to always receive the best care. And as he aged and I grew up, I wanted to bring that care to other families and other grandpas, well, or people in general. I'd like to talk to you guys about my team as well. Many of you may recognize Rachel. She is Oneida. She is Oneida Nation alumni. She went and studied at Bellin College and has a bachelor's in radiology from there. She then completed her certificate in mammography and is our clinical preceptor with Bellin. Some fun facts about Rachel is she likes to be the eyes of medicine, is what she calls her passion for X-ray in the back. She also loves patient care, the advancements in technology, and critical thinking. We have Brianna Sheevy. She has been with Oneida for 5 years and she also went to Bellin. Her passion for radiology stems through patient care, thinking outside the box, and every day being different from the last. Joining me today for moral support is Chelsea. She's been with Oneida for 5 years. She went to Northern Michigan University and has her associate's degree in X-ray and then her certificate in mammography as well. Something you're kind of hearing echoed throughout our team is patient care. It's always patient-centered. Advancements in technology with no two patients being the same. Challenges and adapting to that individual every day drives us in our department. Okay, so let's get into some content here of what we are going to focus on for October. It's Breast Cancer Awareness Month. So what is breast cancer? It's a disease of the breast where cells grow out of control and tumors form. So how does it spread? It can invade nearby tissues, or it can also get to the lymphatic system through your blood. Some factors that are uncontrolled in these situations are your gender. Women with breasts are at a greater disadvantage, aging, and then also your genetic line. Some controlled factors are smoking and alcohol consumption, not physically active or being overweight. And also emerging on the scene is hormone consumption. So, what are some signs and symptoms? As you guys know, the common things are lumps and bumps, but some other things not as often talked about are your nipples, changes in the nipples, them retracting in, discharging, bleeding. Anything other than like a mother's milk is of concern. There can be breast changes to the skin, size, shape, dimpling, skin, etc. And there can sometimes be pain. Unfortunately, there could be no signs at all, and that's why having your screening mammograms done are essential. So what is someone's lifetime risk? For the general U.S. population, 1 in 8 women will be diagnosed each year with breast cancer. Breast cancer is most common cancer, except for skin cancers. For the Native American population, this demographic is at 7% greater risk of diagnosis and 10% more likely to pass from it, with worse survival outcomes due to being diagnosed later in age and then also not pursuing treatment in a timely manner. So again, just to kind of double down on this information, it comes down to disparities in Indigenous health. This is laid bare in breast cancer numbers. As cancer deaths drop in every other group, Center for Disease Control and Prevention says they are rising in Native American women, jumping nearly 2% each year in women over their 40s. It's often, like I mentioned before, it often takes longer for Native American women to get diagnosed. They have one of the lowest screening rates in the country. And I'm not sure if that's just a lack of trust in medicine or what, I don't know, doesn't hurt me kind of thought process. So those with abnormal screening mammograms then are also less likely to pursue the follow-up care. So what we see here at the Oneida Health Center is a non-compliance, and I'll get into those stats in a slide a little later. But breast cancer mainly occurs in middle-aged women, and this may be surprising, but median diagnosis age is 62. Some people may think, oh, 40, 50. It's well beyond that. So let's get screening. What is a screening mammogram? It's a non-invasive, detailed X-ray image produced of your breast tissue. Each breast is placed under compression, 4 total images, 2 of each side, tops and sides. This technique is low dose, like we talked about, to detect breast cancers or other diseases can pop up. Total exam time spent with us here is 15 to 20 minutes. So, where can I get my screening? Here. The Oneida Radiology Department at the Health Center, we offer this service as a screening service. You guys met my team in the earlier slides. I have great confidence in them. I work with them daily. Highly skilled, all certified. We'll guide you through your exam. Our equipment is the state-of-the-art equipment, 3D tomosynthesis, which might sound like a foreign language. What that means is there's slices of the breast, and then it's recreated with the brains of the system into a 3D image for the radiologist, kind of like a CT scan. So they can go through each slice of your breast, identifying and isolating areas of suspicion. It can still perform a 2D image. There are patients who can't hold still, can't hold their breath, etc. So at least we'll get them something. So general guidelines, women 40 and over should get their mammograms yearly. People always are asking us, when can I stop? When is it done? I don't need this anymore. And sure, you can have a conversation with your provider. Women, the guidance is women 55 and older, if in good health, can have biannual mammograms. As a mam tech though, I would still just do it annually. The little clause at the bottom, when can I stop? Screening continuation, as long as women are in good health, you got to ask yourself 2 questions. If I'm diagnosed, will I pursue treatment? And do I plan to live another 5 to 10 years? If your answers are both yes, or just yes to one of them, continue having your mammograms. So, fun fact here. Were you born in the year 1985 or earlier? Then it's time for your screening mammogram. Let us help you with that. No doctor's visit necessary. With the help of our DTS team, this is our QR code to send your information directly to our mam techs, and then we will contact you and get you scheduled. This QR code is on our banner out front, and also we will see what kind of success we have with it, but possibly put it other places as well. Even if you just have questions and you want to talk with a mam tech, scan this, submit your information, and we'd love to have a conversation with you. So we can't reiterate enough. Early detection saves lives. Support starts with screening. Be powerful and be proactive. So let's talk about your results. Each mammogram comes with a report from a radiologist. These are doctors of imaging. They have special credentials and certifications in reporting back, following the guidelines from the Food and Drug Administration. They give it to us in medical terms. We return it to you in English terms, easy to understand. So what if my results are abnormal? Your primary care provider or the care team will call you and discuss the next steps. The radiologists have, they'll inform you the radiologist has specified suspicious area in your breast, and we ask for follow-up. Unfortunately, we do not have that follow-up availability here, and you will work with the PRC team for that referral out. What that would be is like a diagnostic mammo. It usually entails the workup of an ultrasound and then additional views specifically in the area of interest. So what does breast cancer look like? It can look 100 different ways. So that's where these radiologists and then our mammo team are crucial. The next couple slides, we've got some images, and I'll explain them as we go through each. Here we have a right breast. When I talk about 4 images, 2 on each side, this view on the right is from top to bottom. So where the yellow circle is the cleavage, and that is an area of suspicion. Why we take that next angled view of 45 degrees. So we have medial in the center. Now we need to know how high it is in your breast. Go to 45 degrees. Wouldn't you know it? It's way up in her chest in the upper pectoral area. That white looking sail is actually a pectoral muscle, and those are required in this next view. Case B, now we're looking at a left breast and a different representation of possible breast cancer. Again, top to bottom, right in the center there. And when we jump to that 45-degree angle, it's in the bottom of the breast. Another case is throughout the entire breast. There are microcalcifications from top to bottom and left to right. So we'll kind of look at them all at once. To the right was case A. That's called the spiculation sign, a starburst sign. You can see it's got like tendrils. It's pulling everything in. That cancer is grabbing the healthy tissue around it. In the middle is a density sign. This is what you might consider a lump or bump if it gets too big. And then at the end here is microcalcifications. This is why we cannot have patients wear deodorant. It doesn't matter if it's natural, you made it in your basement. On a microscopic level, it can be crystallized, and that is also a sign, well, if it's not your deodorant, for possible breast cancer. So these are just 3 examples of what we see, but there's many. So let's look at some stats from our health center here. 5 years worth. You can see on the left is our totals. That's total volume, total number of patients we've seen. Through the pandemic, we've doubled our volume, which is great. Coming into that next column, how many, might be your question, were abnormal? And we're looking at about a 10% turnaround that have been flagged for follow-up. Let's get into non-compliant. People who are aware that their mammogram was abnormal, there's areas of suspicion, and another, I'd say, 10% are not following up. We do have a policy because of this for women who are non-compliant. They cannot then try and come back in a year. They have to have their follow-up. And once they do that, we will track all of that. Once they're cleared as either benign or otherwise, then they can come back. And then on the end here, we have confirmed cases. I do have to double check my 2022, but we have had 3 each year confirmed. That may seem low, but those are 3 lives then that hopefully have gotten care and are recovering and surviving from this disease. So you have a breast concern. Like we talked about, we do just the screenings here. If you have a lump, bump, nipple change, breast change, skin change, still call us here at the health center. We want to have that conversation. We want to have you referred out, and we want to have you see you get the care you need. So our number is there at the bottom. No insurance, there's resources. Have a consult with our medical benefits coordinator. There's patient referred care. And if things just don't seem to be working out, there's the Women's Well program of Wisconsin. There's a link there, but you can also get those resources with the benefits coordinator. On a more fun note, this year we were blessed with some art from our Mamtech's husband, Tees Miniman. We are wearing them today, but we would also like to wear them on Thursday, October 16th. That is Indigenous Pink Day with the American Indian Cancer Foundation. So just a little spiel on that. The National Breast Cancer Awareness Campaign, led by the American Indian Cancer Foundation to educate Native communities about early detection and encouraging screening. It occurs October during Breast Cancer Awareness Month and calls people of all genders to wear pink, share a photo, and use the hashtag. Participate in the event to raise awareness for the disproportionate impact of breast cancer on American Indian people. So call to arms. October 16th, we'll all wear our shirts again, and then, or pink if you don't have a shirt, and we'll have a group photo again out front. I don't have the date or the times, I should say. We have the date. When we have a time, we'll share that again with everyone. So Indigenous Pink, the power of pink, educate, empower, and assess. And then there's a link to the AICF on the bottom there. So that wraps it up for me. Thank you guys for your time. I really appreciate it, dealing with me and my nerves. Yeah, Kristen?
So for the patients who have to go out for diagnostic mammograms, is that able to be done locally?
Yes. Oh, good question. So the question is, if I have to be referred out for after abnormal screening, are there local facilities that will take care of me then? So yes, based on your insurance, what's allowed, Aurora, Bellin, Prevea will all be able to take care of you. We do see majority go to Prevea Health, but HSHs. Thank you. Yes, Sid.
There was a question from the community in that there was a female member whose family had breast cancer at an early age, like in their 20s, like multiple people, multiple aunties having breast cancer. Does that change the guidelines for the screening process?
Yeah, good question. So to repeat Sid's question is, I'm under 40, I've got family history, I've got a concern, am I able to get care? You won't be able to have a screening mammogram here, but with the grounds of, I have a concern, I have family history, it is a referral out then for that diagnostic mammogram right away. Sometimes it's also an ultrasound. With young, dense breasts, things can hide. Suspicious areas can hide in those densities. So ultrasound is their next best tool in the young population that may have dense breast or family history, stuff like that. Thank you. Anything else? Peggy?
Yeah, over the time that you've been working in radiology, how have you seen the technology change and getting to the point where it's to the level that it is at now?
Sure. So the question is how have I in my tenure seen advancements in technology? I was actually still trained in film screen printing with the chemicals in the dark rooms. That was being phased out into like the digital. We've seen it go from those big chunky cassettes to now digital. We've seen mammography go from 2D, which is just two plain images, to the 3D, which is the recreation of the whole breast for the radiologist. Hi, Dr. Ling. So that has all been within the last 10 to 15 years. And actually, we've gotten word that, again, the mammography equipment has come to its next phase of advancing technology, and we'll be seeing that in the next 2 to 3 years as well. So it's the more we talk about it and the more we promote breast health, the more the health industry and technology want to support that. They want to be on that trend. They want to be driving it as well.
So has that changed the accuracy?
What has it changed the accuracy was the question. It's improved the false positive ratio. So back when it would be just like 2D and two flat images, there would be a lot more callbacks because they just weren't sure, but they wanted to err on the side of caution. Now with the 3D, it's more accurate. It's less of the false positives. It's more of like, we're very suspicious and you need this follow-up. I thought maybe you were going to get into like AI. And no, I'm not going to go anywhere when AI comes. No. There are some things I've seen with AI where the 3D, they're creating teams where like the 3D is adding AI as like a support, but not the final decision. Do you know what I mean? So we'll see. But may I take any questions? Other questions? Okay, thank you guys. So would you like to do the?
Sure.
I'll welcome Sid back. Thank you guys.
Awesome. Okay, so we do have a little bit of a different survey format. I want to thank Peggy for helping out with this. It's going through Microsoft Forms, so if you have your phone, please take it out, scan a QR code. It should be rather simple and painless. Gives us an idea of what type of things that you want to see in the future, provides feedback, lets us know how to do better overall. So appreciate Peggy for doing the survey and putting this together. I'll just pause while people can do that. And then I want to say, Yonko, it's much appreciated. We always enjoy the opportunity to provide information. If there's topics, please forward that along to our survey request. And we do have our contact information. So if there's any other questions, concerns, or comments, we certainly can put you in touch with Courtney and her team. Yonko.